significant developments overnight. I start with the good news. There has been no additional positive cases in Robinson River. For Katherine, I will start with the positive cases. We are now calling all cases since yesterday the Darwin and Katherine Robinson River cluster number 2. It may be linked to cluster number 1 that had the 21-year-old source case. This is not established yet. There were 9 new positive cases of COVID-19 in the Northern Territory linked to cluster number 2 overnight. This brings the total number of cases for cluster number 2 to 11. All 9 new cases are close household contacts of cases number 1 and 2. The 2 cases I updated you on last night. I will now go through these 9 cases in age order. All of the new cases are Aboriginal Territorians. A 71-year-old man, a 65-year-old woman who has been admitted to Royal Darwin Hospital, a 62-year-old woman, a 40-year-old woman, a 38-year-old woman, a 22-year-old woman, a 16-year-old girl, 2 5-year-old girls, twins. I don't have vaccination status details yet. Bar the 65-year-old woman who is at Royal Darwin Hospital, all other cases are or are going to the Centre for National Resilience. This is obviously a serious escalation in the COVID-19 situation in the Northern Territory. A major contact tracing effort has been underway since the first case we reported yesterday. There are new exposure sites which I will run through in a moment, and there are currently 161 close contacts. I want to touch on 2 important exposure sites separately, so I'll run through the other exposure sites now. These are all close contact sites. So if you have been to these places at these times, you must immediately self-quarantine, call the COVID hotline, and we will organise a test. Captain Jack's Fish and Chips yesterday, 15 November, from 12 p.m. to 12:35 p.m. Again, close contact site. Worley Health Service main clinic yesterday, 15 November, from 10 a.m. to 11:45 a.m. Kirby's Pub, Katherine Hotel, Wednesday, 10 November, from 10 a.m. to 6 p.m. Again, I repeat, close contact sites. Kirby's Pub, Katherine Hotel, Friday, 12 November, from 12 p.m. to 4:30 p.m. 2 important exposure sites I want to run through now, and they are the Katherine Hospital and the McFarlane Primary School in Katherine. First, Katherine Hospital. The times and specific locations we are still working on. Please keep monitoring the coronavirus website as we will provide that information shortly. Please pay close attention. Second, McFarlane Primary School. I encourage parents whose kids normally attend McFarlane Primary School but because of the lockdown are not at school today to please get your kids tested today. That's a request. McFarlane Primary School will be open tomorrow in line with the lockdown rules. So that's kids of essential workers and kids of vulnerable families. However, all kids will need to be tested on arrival. I know this is a serious development. We are doing all that we can to make sure that you are safe. This is what we are doing. The Katherine lockdown is extended to 6 p.m. Monday, 22 November. That makes this a 7-day lockdown. We have sent extra vaccines to Katherine. We have surged people to the vaccination clinic at the old high school site. Last week, we started a door-to-door public housing vaccination effort in Katherine that continues this week. We've extended testing hours to 6:30 p.m. and set up a second lane at the testing clinic at the hospital and put in additional staff. A walk-in testing clinic is now open at the Katherine Community Centre on 2nd Street. A meeting has been held this morning with the 3 Aboriginal health providers in Katherine, Sunrise, Worley and Katherine West. They are with us coordinating mobile testing, mobile vaccination, contact tracing, welfare support and education on symptoms. This is a coordinated effort. We are all working together. We'll do everything we can together for the people of Katherine. All Territorians have a call to action. There will be a mask mandate for all Territorians until 6 p.m. Monday, 22 November. You must wear a mask whenever you leave the home. You are permitted to remove your mask if undertaking vigorous exercise. If clusters 1 and 2 are linked, there is a significant gap between the last case on November 4 and the first case of cluster 2 on November 13. There is a chance the virus has seeded and moved. I need all symptomatic Territorians to get tested. We want to see a testing response across the territory. There will be daily wastewater testing in Alice Springs, Tennant Creek, Katherine and Darwin. I provide a warning today. A positive wastewater result in one of these locations may be enough to trigger a lockdown or lockout decision. These are tough times in Katherine. I thank you all for complying with last night's snap lockdown direction. This is the third time Katherine has had to be locked down. I feel for the people of Katherine and Katherine businesses. We do not want to have to lock you down. You have done everything we've asked and you've made sacrifices for every Territorian. We're doing everything we can today to test and trace. We will not stop working. I thank everyone in Katherine who is vaccinated. The vaccine rate for Katherine is about 75% second dose. Everyone who has got vaccinated has done their bit to protect themselves and their community and to protect the Katherine economy. Your next job is to convince any of your reluctant friends to get the vaccine. Vaccines save lives. The vaccine rate for Katherine overall and within vulnerable pockets is not at a level where we can consider lockout as an option. This is our challenge to the people of Katherine. This is how you can best help us, yourself, your loved ones and the community. We need to see a vaccine response in Katherine. We need to see a testing response in Katherine. I know you can do this, not in theory, in fact. You have done this before. Let's smash this, Katherine. To Robinson River. Our rapid assessment team arrived last night and they are already hard at work. Their top two priorities being to offer the vaccine to anyone who needs it and test for new COVID cases. We have conducted about 20 priority tests in Robinson River that will soon leave for Darwin and we should have results in the morning. We have enough tests to test the whole of Robinson River community and all of Robinson River will be tested over the next 2 days. But we are under no illusions that the risk for Robinson River remains real and we have more testing to do today. I mentioned yesterday that Robinson River has a good vaccination rate. 87% first dose, 77% full vaccination. As per our rapid response plan, additional supplies of the vaccine have been offered to anyone who is eligible and yet to be first dosed and fully vaccinated. This measure can save lives. I'll update you on changes to the Robinson River vaccination rate as I have it. The lockdown in Robinson River is in effect and compliance has been excellent, thank you. The people of Robinson River and surrounding homelands have responded magnificently. Borroloola. We have no known links yet to Borroloola or a reason to lock Borroloola down. We have sent a vaccine team to Borroloola this morning. We have stepped up our testing efforts in Borroloola and are asking anyone symptomatic to come forward for testing. Everyone who was tested positive yesterday and overnight are Aboriginal Territorians. Some of our best vax rates are in our remote Aboriginal communities. There are some very low vax rates in some remote Aboriginal communities. Please, we still have time for people to be vaccinated before COVID becomes a reality in your community. As the Cho said yesterday, as I've said before, you only have two choices. Catch COVID vaxxed or catch COVID unvaxxed. Please, please get the vax. And a final thought. Our schools are open in Katherine for Year 12 students doing exams. Doing your study during a pandemic is a test in itself. During a lockdown is a tremendous display of character. No matter your results, I am proud of you. The Territory is proud of you. Studying during a pandemic, doing your exams during a lockdown. You have got this. We'll do everything we can. So all you need to do is focus on your study and focus on your exams. We've got your back.
Thank you, Chief. Thank you for coming, everyone. So we're now in a clearly very serious situation. We have 11 cases now associated with this second cluster. 9 of those were notified to us overnight. There's clearly significant spread in 2 households. We can see how fast it can spread. We don't know how far it has spread. We really need our community please to come forward and get tested at this stage. We're in a desperate race to track this down and identify those further cases. We clearly can see what the potential is in Katherine and beyond Katherine, Robinson River and other parts of the Territory. We've had to put in place some further measures today, which we hope will slow it down, but we are reliant very largely on our community to come forward and get tested, help us. I'll speak to in a minute about contact tracing, get tested and get vaccinated. If you're still waiting to get vaccinated, you could be exposed to the virus at any time. You're taking that risk of being exposed to the virus unvaccinated. And the consequences of that, particularly for the communities in the Territory, could be dire. On the contact tracing, please, it's extremely important. We've had very good cooperation. I'd like to thank all those who've helped us with the contact tracing and giving their information. Much of that excuse me, is very confidential. We treat it as highly confidential. Please trust that process and give us all of the information that you have about your contacts so that we can track these down. Thank you.
Good afternoon, everybody. Now's the time, Territorians. You're really going to have to step up now. The simple fact of the matter is this was what we were always planning as somewhat of our worst case scenarios that relate to this permeating an Aboriginal family in the Northern Territory. As I've mentioned on many occasions, the harsh reality of overcrowding is something that leads this particular Delta strain to be very problematic. And the speed at which we've been able to identify a number of these close contacts now being positive should signal a very strong warning to everybody about how transmissible this is, particularly in the Northern Territory context. If you're a nonconformist, if you're a non-believer, it's time to change the direction of your sails, because it is here. And we've taken the immediate steps to lock down Katherine and Robinson River, but we have to be prepared that other communities may follow. I've already sent additional resources to Borroloola. We hope that Borroloola does not need to go into lockdown, but we have to prepare so we can move immediately in the event that any data tells us and the public health advice tells us that's the move we need to make. The mask mandate across the Territory is a protection for you, for your loved ones, and all Territorians. Compliance is expected. Everyone has been on the journey long enough to know the imperative of wearing the mask and how that is a key mitigation of the spread for us. But please be conscious, it's also about adhering to the broader principles. Use your hand sanitiser, keep good hygiene, try and maintain at least 1.5 metres physical distancing where you can. That's going to be particularly important because we know in between the window of the media conference yesterday and the 6 p.m. lockdown for Katherine, there was significant vehicle movement north and south of the town. We know there's some key funerals and other ceremonies going on through other parts of the Northern Territory at the moment where people who may have been in Katherine over the recent days have already travelled. Hence the reason we need to spread the net wide from a mitigation perspective and why the mask mandate is in place. It is clear we're going to be moving significant public service and police resources across the Northern Territory to various parts to try and ensure that we are containing this wherever possible, doing the absolute most we can to get the testing results back into town so that those results can be turned around quickly to keep informing our public health posture and the future direction of this current issue that we're dealing with. My people cannot be distracted, so to any of you who have been involved in protests, any of you who are involved in any action, please do not be a distraction to my people. You are going to place the lives of vulnerable Territorians at risk. So just take some time, be more community minded, hold your peace until we get out of the mask mandate, until we get out of these lockdowns, and then resume your activities lawfully. I can't be bothered dealing with your rubbish in the interim. There is just too much at stake. Compliance so far in Katherine has been pretty good, although there are already some people pushing the boundaries. I trust that the news today of the number of positive cases that have now been attributed to Katherine are sufficient warning for you to make sure that you're compliant. This is the time for the true Territory spirit to stand up. It's an expectation because there's just far too much at risk. Thank you.
You mentioned there, the Police Commissioner mentioned there are a number of people who left Katherine before the lockdown came in force. Are you concerned that there may be close contacts among those who left Katherine?
One reason why we have the mask mandate in place for the territory is potential of movement since November 4. So the fact there was some movement prior to the lockdown, yes, there's obviously a concern, but the potential of seeding between November 4 and November 13 is probably a greater concern. So for us, we've stepped up into a daily wastewater testing posture in Alice Springs, Tennant Creek, Katherine and Darwin. In most of those places we had daily wastewater already. Some of it was weekly, but it's now daily in all those locations. We're also doing a wastewater test in Borroloola, so I should mention that earlier, to test what the Borroloola wastewater is as well. So obviously we're a bit concerned about the potential of seeding since November 4, and that's why we've gone to mask mandate. The movement before lockdown at 6 o'clock, not great. There's always some kind of movement, unfortunately, but it's the seeding that probably most worries me.
Chief Minister, so the Katherine Hospital is now an exposure site. Worley Wellington is also closed because they're an exposure site. So what's the anti-government doing to fill those gaps in healthcare now that are in Katherine?
So I think it's important to note there won't be gaps in healthcare. That's the intention. So obviously we haven't shut down the Katherine Hospital. Experiences, and I'll get Dr. Payne to add to this, experiences of Victoria and New South Wales inform how you do the furloughing of staff to make sure you maintain service delivery, so you can operate hospitals through the fact they become exposure sites. That's a genuine risk of COVID. Obviously all of this happened just prior to our vaccine mandate coming in. So most of these places should be 100% first dose. They obviously are 100% first dose today, but at the point in time they probably were 100% first dose, but that was just around the mandate time. There's been a lot of work going, I'll get Dr. Payne to add this, a lot of work has been done in and around how you handle staff who may be considered close contacts to maintain service delivery. So there's been movement away already from the 14 days to a testing regime and a risk assessment. So I'll get Dr. Payne to add to that, so you've got confidence that there will still be service delivery. This applies to both Worley and to the hospital. I just need Dr. Payne to add to that, it's important.
Thank you. As the Chief Minister has said, our priority is to maintain services. We must maintain those services, and we've seen from the experience in Australia that we can manage with double vaccinated staff, with daily testing. We can have people return to work under those conditions. We're working through today our risk assessments of those sites and individuals, and we will be maintaining services. There won't be any interruption as a result of that. We can move to a different phase of managing this in terms of close contacts.
Does the Katherine Hospital have capacity to care for people with COVID-19, or are they all being moved to Darwin?
They do have some limited capacity to manage COVID patients, but at this stage, with the small numbers, our priority is to get them up either to the CNR or to the Royal Darwin Hospital if they need treatment.
How limited is the capacity?
At the Royal Darwin Hospital?
No, in Katherine.
Oh, in Katherine. They can manage up to 4 patients with high flow oxygen, which is a high priority in the urgent phase or the acute phase, and beyond that we will be transporting them.
And Dr. Payne, you mentioned that 2 households were affected. Is the second one in Robinson River, and how many people live there?
In Robinson River. We don't have detailed information on household sizes there yet. We only have the one case in Robinson River, which is connected with Katherine.
Sorry, how many people lived in her household
in Robinson River? We don't have that information yet.
The woman in her 60s in Royal Darwin Hospital, is she very sick?
She's on a ward at the moment. She's not very sick. She did need hospitalisation, so she is acutely unwell, but at this stage not requiring intensive care.
What is the capacity at Royal Darwin Hospital as far as ventilators go to deal with, to treat people if that is required?
Yeah. So the capacity, I won't give numbers, but we have, according to our modelling, we have good capacity for the numbers of cases that we're expecting. We have the ability to expand that capacity as well. We can more or less double our capacity if we need to. Obviously, that will be made. An assessment will be made of our needs for that, to do that as the numbers of cases rise, if they do.
There's a call this morning for Borroloola to be added to areas being put into lockdown. What are your thoughts on those calls?
Yes. We've considered that very carefully. At this stage, we don't have any direct epidemiological links to Borroloola. We don't have any cases there. As the Chief said, we will be doing wastewater testing to see if there's any evidence of cases in the community. So at this stage, we're comfortable that we don't need to, but as we have done all the way through this, we will escalate if necessary.
There's a gap in between the first cluster and the second cluster of several days.
Yes.
And how likely is it that there's widespread transmission of the virus now in Katherine?
Yes. We think it's unlikely there's widespread transmission at this stage. However, we cannot be absolutely confident of that. With the testing, although it's not been desirable, we haven't had the testing rates that we would have liked. Even with those tests, we would have expected to pick up cases if it was widespread. But I don't want to give any false reassurance about that. We are in a desperate fight now to identify new cases in Katherine, and I do need people to come forward and get tested. Thank you.
The school in Katherine, how many days did children go to school while infected?
Sorry, I missed the
The school in Katherine,
Yeah.
that's a close contact, how many days did infected children go to that school?
We don't have any infected children in the school. It's a teacher, and so we're doing the contact tracing there. So that's the answer to your question. Yeah.
Do you have a condition for the 65-year-old woman who's been taken to hospital?
The condition, I did answer that before, but she's unwell. She needed hospital treatment, but she doesn't need intensive care at this stage. Okay.
And what about the other 10 people who've tested positive over the
Yes.
past 2 days? What's
At this stage, they're in CNR, and CNR has some medical facilities. They're certainly under close scrutiny, and if they need care, their care will be escalated. But no one at this stage is requiring healthcare.
Chief, Senator Melanie McCarthy this morning mentioned that her sister had been had tested positive for the virus, that she was the person, source case in Robinson River. Have you spoken to the Senator?
The Deputy Chief Minister and Minister for Health will be doing those stakeholder calls. That includes Senator McCarthy. I'm not sure if we're describing the woman in Robinson River as a source case. I don't think the source case has been identified, if that makes sense. If it's linked to the cluster 1, then the source case is the 21-year-old. Right now, we wouldn't be describing anyone in the cluster number 2 yet as the source case. That'd be correct, Dr. Payne. No one's been called the source case yet.
Do you have any more details about the actual flight that this woman took from Katherine to Robinson River? Was this an annual flight or do we have any of that information?
The Commissioner may. Do you have information on the flight?
So that flight was a charter flight, and the contact tracing teams are making relevant contact with the relevant charter company, and also to determine if there are any further passengers on board. And in the event that they were, they'll be contacted, and CDC will do their thing.
The Senator this morning also said that up to 20 people in Robinson River share a home. How concerned are you that overcrowding limits the effectiveness of a lockdown?
Well, that's been a concern in all our remote communities, and as part of our COVID response plans for each individual remote community goes to how you handle that overcrowding element. We also know that Delta has a close to 100% infection rate within a household, so it does concern us if it gets into a household, or any household, particularly an overcrowded household. That's obviously a lot of people will then be positive, and then there'll be a lot of contact tracing efforts off the back of that. We are working with the Commonwealth around a biosecurity zone for Robinson River and those homelands. But having said that, everyone in Robinson River is complying, so it might not be necessary, but the biosecurity zone will come in. Everyone in Robinson River has been excellent for the testing. As we mentioned earlier, no positive results yet. The vaccine gone in, but there's already good vax rates in Robinson River, and we've obviously surged up a reactive vax team into Borroloola just in case as well.
With the exposure sites at the Kirby's pub, do you know how many people roughly were there at the time? Is there CCTV that allows you to identify who those people are? And do you have concerns that the virus could possibly have been spread to other remote communities from Katherine?
Yeah, so a couple of things there. I don't have off the top of my head the check-in numbers for Kirby's. I'm not sure if the Commissioner has that. No, so we can get you that information about the amount of people at Kirby's. It's probably the length of time too. At both Kirby stints. We're obviously worried, separate to Kirby's, we're worried about possible seeding out of Katherine simply because of the time between November 4 and November 13. in addition to obviously the exposure sites. So between those two things, we're worried about seeding, and that's one reason why for the mask mandates in place.
Have you discussed with the Commonwealth any additional support that they could be providing to help Territory get on top of this?
We've been talking to the Commonwealth. At this stage, we haven't made a direct request for personnel assistance. We've obviously asked for that biosecurity zone. I think that the role the Commonwealth has played in the past with these efforts has been if they determine it a hotspot and their income support. So the Commonwealth's always the one that's been responsible for income support during the pandemic of the last 18 months. No territory or state government's been able to do income support. So I think for the people of Katherine, that might be something that would be reasonable for the Commonwealth to consider, and we'll be approaching them around that, especially considering the last lockdown was so close to this lockdown and may be linked. They've obviously got some of their own triggers about what puts in place a income support. That's up for the Commonwealth though.
Do you have any plans to move caravans or temporary housing to Katherine in order to spread out families living on top of each other, like what we saw in Wilcannia?
We have the capacity to do anything at this stage. We don't need to activate any of those plans. So we're doing those testing efforts. Testing helps inform a lot of things, so we need to see a good response in our testing. The territory-wide testing result yesterday from memory was 1,200, so we just want to see more testing, Katherine, obviously.
Two of the cases that you revealed today are 5-year-old twins. I think the Chief Health Officer said yesterday that at this stage it doesn't look like we'll have vaccination of kids under 12 until at least January. Are you in any discussions with the federal government about trying to bring that forward?
It's something we discuss in National Cabinet. Obviously, I respect ATAGI, I respect the TGA, I respect all our health professionals, and they'll make those decisions at a point in time when it's safe to do so. All I'll say is the moment that we have the ability to provide vaccines to 5 and 11-year-olds, it's obviously all with parental permission, we will absolutely prioritise that vaccination effort. I think it's crucial for a significant number of reasons, particularly though because of the Doherty modelling that's come out that said for our remote Aboriginal communities to cut down the to reduce the epidemiological links, we need to be 80% double dose 5 and up. We simply have to have access to a vaccine for 5 to 11-year-olds. I know there are a lot of parents out there worried for their kids. I know that COVID is low risk for children, but it's not no risk. And we still don't know the long-term effects of COVID, and we still don't know all the impacts of long COVID. So I completely understand why parents would like to have access to that vaccine as soon as possible, especially in the territory where, unlike basically the entire world, Territorians have had the opportunity to get vaccinated before COVID gets here. And when you consider just how close we are to having a vaccine to 5 to 11-year-olds, I absolutely understand why parents in the territory would be desperately keen to be able to have that permission to vaccinate their children before we have COVID endemic here. I absolutely understand that. As soon as it's safe to have that vaccine, we will prioritise the rollout of that vaccine.
Do we have any idea about what the vaccine uptake has been in Robinson River and Katherine since you sent out those extra vaccines and since the outbreak?
I don't have a figure, unfortunately, for vaccine rate uptake in Katherine and Robinson River since we made the announcements yesterday. I know it's been happening. I'd be keen for a bio count if that makes sense. I'm not interrupting their work at this stage. So the health know I'd like to have that figure as soon as it's possible, have that figure without interrupting what they're doing, and we're happy to make that figure public when we know it.
We had 2 cases yesterday, we've got 9 today. I mean, is this the beginning of an exponential rise in cases? Should we be bracing for dozens of cases over the next few days?
This has that capacity, and we've seen it happen elsewhere. We've got good firm rules in place in Katherine and Robinson River. I'm hoping that we've been swift enough. We'll know very soon. The 2 cases yesterday came forward symptomatic and got tested, which I think is really important. So we've caught them. And every chance because of that, because of what they did, because they came forward for testing, we've caught this early enough. What worries us, what worries myself, what worries Dr. Payne, what worries the Territory Controller, what worries everyone in SEMPSI, Deputy Chief Minister, Health Minister, all of us, is that gap between November 4 and November 13, and we do not have an explanation for that gap yet. It's likely the 2 outbreaks are linked. It could be a second incursion of COVID into the territory, but obviously, keep the explanation simple, it's more likely those two outbreaks are linked, cluster 1 and cluster 2, which means there's a missing link and missing cases. It may be an asymptomatic individual, but we would obviously be desperately keen to be able to understand that link. We'll have the genomic testing results give us some certainty if outbreaks are linked or not. But that prospect of seeding worries me. There's every chance with this outbreak, this cluster, we caught it early enough because those two people came forward for testing, but we just don't know what's going on in that gap.
Please, guys. Chief Minister, so you're saying that all Territorians from now, right through till Monday night, face masks?
6 p.m. masks. We're also asking all Territorians out there to come forward for testing if symptomatic. We want to see an increase in our testing results across the Northern Territory. We've also got a daily wastewater results. It'd be extremely helpful for us if there are high testing results in those places where we're doing the daily wastewater testing, so we could consider both those results together. So, for example, if we have a superb testing turnout of symptomatic people in Alice Springs, that'll help us make any decisions.
Is this the biggest challenge that the Territory has faced since the start of the pandemic?
We've faced a lot of challenges. This is probably the most serious. I'd say still when you go back to last year, we locked down the whole Northern Territory as part of the national lockdown and stepped out of that. That was obviously a big impact on every Territorian, and every Territorian was magnificent. That was just a huge body of work. We can't forget what the public service did, what every business did, what every Territorian did during that national lockdown. But this is without doubt the most serious incident we've been dealing with. This is a lot of cases. This is a case in a remote community. These are all Aboriginal Territorians. This makes real every fear that we've had. This demonstrates, I believe, to a lot of people out there who have had doubts about the reality of COVID, who have had perhaps a naive complacency about the fact that our border could just hold everybody out forever or hold COVID out forever. That was never going to be the case. All our COVID measures to date have been to reduce risk, and they've been successful, but we've never been able to guarantee that COVID couldn't get here. We're one of the last place in the world where COVID's coming, but it's coming. Thank you.
Thanks, everyone.
Yeah, that question.